in terms of psychiatry, there are significant worries amongst many of our members about encroachment onto the profession in terms of its role, in terms of the legal boundaries, in terms of, say, Section 12 permissions, in terms of diagnosis, in terms of any sort of encroachment by other healthcare domains or healthcare professionals. And it's something which I'd be very interested to hear your position and what you might be having as your position in terms of the president of the Royal College of Psychiatry. How would you defend psychiatry as being its role in terms of patient care, as in having such a critical role? Because ultimately, a lot of our members do not want to have their jobs encroached upon and put at risk regarding these issues.
So fundamentally, psychiatrists are doctors. The Royal College of Psychiatrists exists to support those psychiatrists, and it does so by setting and ensuring high standards, not just for the psychiatrists, but also for mental health care, actually, and also providing kind of quality assurance of those standards. And psychiatrists are the only group of professionals who can deal with the complexity, the breadth and the longitudinal overview of a person's care, and most importantly, take responsibility for that person's care. And remember that these are people who have disorders that cause huge amounts of morbidity, disability, and unfortunately mortality. And there are very few professionals who will feel comfortable and are trained to take the responsibility that's associated with that. The other thing is that people don't realize this, but we know a lot about mental illness. We know a lot about what causes it. There's a great deal of science underpinning the work that we do. And the science that underpins the work that we do is stuff that psychiatrists really understand and have because of our training as doctors. We have really good understanding of that and are able to apply that understanding to the real world. Again, that's not easy to do. It's complex. It's a complex task. And I think that psychiatrists are the only people who are able to do that effectively on a regular basis at the same time as taking the responsibility of being a doctor. And that responsibility is a very weighty one, actually. So I'm not saying that there are the other professionals also has to take responsibility, etc. There are certain things that and in fact we need the other professionals, the psychologists to support us with the psychological talking therapies, the talking therapists. We need social workers to support us with the social work duties, etc. Physicians associates can help with doing some of the circumscribed tasks, like supporting with physical health issues, supporting with maybe doing even kind of helping with risk management, but they can't do the whole lot together because none of them are trained to do that in the way we are.
Certainly, that is a very reassuring answer in terms of a lot of our members, in terms of the concerns that a lot of our membership in the BMA, in terms of a lot of juniors have about their position getting eroded with a certain degree of scope creep. And I'd be interested in terms of your position and in terms of you being a future president of the Royal College of Psychiatry, in terms of certain changes to the Mental Health Act and how psychiatrists are vital in terms of being one of the few professions in which we can erode someone's liberty. We can impinge upon that. How can we, as a profession, defend our rights and defend the patient safety in terms of only having it in the hands of qualified doctors? Say, for example, Section 12 permissions, in terms of the requirements to have Section 12 permissions. Is it something that we could discuss about not compromising the standards in terms of having to pass MRC Psych, and in terms of being a registered physician and psychiatrist, and as well as in terms of giving diagnoses, in terms of the legal for the legal requirements in terms of the Mental Health Act, how you want to ensure that it is a psychiatrist, a fully qualified psychiatrist who's able to undertake those duties.
So I need to remind you that in order for someone to be sectioned, particularly under treatment section, you usually need 3 people involved. At the moment, it's 2 of them are psychiatrists and 1 of them is actually an approved mental health professional. It always used to be a social worker, but that AMP, as they were, no longer necessarily has to be a social worker. Now you will know that there are increasingly there are approved clinicians. Approved clinicians do not necessarily approved clinicians who can be responsible clinicians who are not necessarily psychiatrists. And that role was brought in to address the shortage, actually, of Section 12 approved psychiatrists. Those people, depending on who they are, and I mean, they have to have quite rigorous training, etc. They can be, those roles can be really successful and really useful. I don't necessarily think that the only people who can be responsible clinicians are psychiatrists, because that's not the main thing we do. And in fact, there are lots of psychiatrists who don't section people because that's not part of their role. I do think that you do have to be very experienced in mental health and you have to have a high level of training. And that's one of the reasons why in many areas you don't get non-medical RCs, because actually people don't feel confident in taking on the responsibility of being being an approved clinician and being an AC. I think that it's unlikely that anyone would undertake this in a way that it's not a light undertaking, put it that way. It takes years for them to become ACs, and they are usually very senior people when they start to do it. I don't think it particularly threatens the role of being a psychiatrist. Second point that I thought you were going to touch on at the beginning was about the Mental Health Act and whether, and what does it mean? What do I think it means for us to have a Mental Health Act at all? And I say that because I was involved in the Mental Health Act reforms and developing them, and wrote a lot of the stuff in developing the recommendations in the Mental Health Act review. And when it involves huge numbers of people, and there were a whole group of people who said you shouldn't have a Mental Health Act at all, actually. What right do you have to take a person's liberty away from them? And in fact, in the end, we decided that we did need a Mental Health Act, because without it, people with mental illness are abused. You need something to help safeguard those people. And what we wanted to do was ensure that the Mental Health Act was as far as possible in line with human rights legislation, and that's the kind of approach that we took with it. But I definitely think we need a Mental Health Act. It provides safeguards that otherwise wouldn't be there, and unfortunately that would lead people with mental illness open to frank abuse. And I think other people, non-psychiatrists can be approved clinicians, but they need a lot of training and a lot of guidance.